Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Ladies and gentlemen, welcome back again to Health Talk Desk. Happy New Year. We are back to you again with interesting stories about your thyroid. This is where we discuss about your thyroid health. Remember to subscribe, hit the notification bell, share, like. Now, sambaze, at least a friend, make sure a friend has subscribed and is watching us, is learning from us, and we all create awareness about your thyroid disease. Now, leo tuko kitu suru. Before tumewapeletea story ya a gentleman called Yad, na leo tuko na the mother who is a caregiver and a patient of thyroid at the same time. So our discussion today will be very educative. It's good for you to watch if you're there watching us as a caregiver and a patient thyroid. I'm encouraging that you watch us and you subscribe, share with a friend. We are introducing our guest today, Rehana. Karibu to the desk. Tell people your name and then we move to the next.
Thank you so much, Alan, for having me on the show. I'm happy to be here to speak to you. My name is Rehana Mohammed. I'm a caregiver to a thyroid patient. My son was a hyperthyroid patient. Incidentally, I'm a patient as well. Other than a caregiver, I am a hypothyroidism patient. So I'm glad to come and share the insights, the challenges we faced, the road to recovery, and where we really are. But importantly is to create awareness about this disease. There's a lot of misconception about thyroid. Yeah, there's very many people thinking it is what it is not. A lot of misdiagnosis that gets into it. So we're here to demystify, to educate people so that you can have a healthier life, even when you have the disease.
Thank you very much. So if you have not watched Iyad's story, even before you watch Rehana's story, please go back and watch Iyad's story so that you can connect what we're discussing today. So Rehana, tell us, as a caregiver, what was your experience with Iyad? And as a mother, you know, and as a parent generally, how was your experience with Iyad? How did you come to realize that Iyad was sick? What was your relationship between yourself and Iyad? And what was Iyad's relationship with the brothers and sisters?
There's already a lot of information about thyroid, but I'm also very glad, Alan, that you have begun this channel, because I will start with Iyad's story and I will explain why I think this is a great channel to talk about these things. A lot of times, when someone hears thyroid problem, they believe it's a hormonal issue. And hormones mostly affect women, or to a great extent, slightly older men.
Yes, yes.
Now, when it is unique, now when it is a teenager who's a man, you know, I recall one time, very funny, I said to my friend, my son has thyroid, it's a hormonal issue. I was like, what the hell? Does it? I thought this relates to periods in girls. Women, I said, well, he's a boy. So, and that is where the misdiagnosis comes in.
True.
When Iyad grew up well, you know, he finished his primary well, he went to a boarding school, no issues. Into his second year, from 2, we started noticing something isn't right. You know, he's athletic. He's a footballer, so he plays football. But all of a sudden, there's fatigue. All of a sudden, there's mood swing. All of a sudden, you know, he's just not himself. He wants to isolate himself. You know, then there's conflict right there with his dad.
Yes.
Because, what is wrong with you? Get out here. Come and sit with people. Let's have a meal together. A huge challenge. To be very honest, at that point, even I didn't think there was a problem. I took it as adolescent, you know, maybe a transformation, you know, there's all these things going on. Yes. Or, you know, he's trying to fit into high school, a boarding school, an environment he'd never been into. But it didn't seem to end. You know, every time he came home for mid-term or end term, something was always a miss. It was worse than he left. There was a lot of, so the symptoms that we picked that started alarming us, he lost a lot of weight. And all of a sudden I feared, are you not eating in school? I actually remember his dad went to school, had a sit down with the teacher, and the teacher said, this boy will be eating in the staff room. Now, I must tell you that he went to a mixed school. You can imagine being fed in the staff room.
Oh, wow.
So challenges, already it's eating into his esteem. So there's weight loss. He came back with extreme fatigue. He came back with lack of concentration. You know, he was actually all over the place. Mara, amesahau, you're sending huku, amesahau, you leave him with something to do, he forgets to do. And then I started to notice extreme tremors. You know, he was shaking.
How old was Iyad at that time?
16.
16 years.
Yeah, Iyad was 16 years. You know, what comes in mind, the first thing is this boy abusing something?
Something.
It can't be normal. It cannot be normal. Now, I take you a bit into this conversation. About 8 months before all this, I was diagnosed with hyperthyroidism.
Hyper or hypo?
Hypo.
You now hypo.
Hypo. Now, hypo, the symptoms are extremely different. So you can imagine the conflict between the two of us.
Yes. He's hyper and you're
I'm hypo. So but before I knew, but now, okay, I know I'm sick. I have hypothyroidism. So, but this boy is exhibiting issues that are completely different from me. In fact, the father told me, stop talking to this boy because you guys will continue mutapigana. You know, I'm hot, he's cold. I'm adding a lot of weight, he's thin.
Yes.
You know, he doesn't eat, I eat. You know, it just was, we were about to go crazy. Anyway, he went back to school. I remember particularly this time we were called and I was told, Mama Iyad, you need to come to school. And I went to school and I was told, do you know this boy sleeps in class every day?
So the teachers called you to tell you your son sleeps in class. Just that? Just
that. And I was asking them, lakini mwalimu, you get me all the way from Nairobi to come and tell me a child is sleeping in class. Deal with it. Is it the only child sleeping? Yeah. Yes, but you know, ma'am, much as he's sleeping, there's something not right with this child. Is he sick? And I figured, why is the teacher picking that my child is sick before me?
Yes.
I said, no, mwalimu, my child is not sick. Anyway, we had the meeting and I sat him down and I asked him, are you sick? Do you have a problem? He told me, no. Well, you know, once in a while I have headaches. I have recurrent bacterial infections. And I kept saying, boarding school facility, you know, boarding school facility.
And at that time, you still not notice that he could be sick of anything?
I didn't think, to be honest, Alan. I did not think there could be anything more than just the stress of school or joining a boarding school at that, or just getting into that adolescent stage. Until he came home for midterm. And that is when I started telling his dad, this boy is definitely sick. Something is not right. His concentration span is bad. His eyes are bulged out. His tremors now were much more than we had left. And something isn't right. And now we were wondering, what do we do? Of course, he went to hospital. Very unfortunately, that time he had a throat infection. And that's what the doctors picked, throat infection. We came back. He was treated. We were fasting, actually. And just before the fasting period was over, he had to go back to school. And that is the day that my heart knew for sure this boy is sick. Because when he wore his uniform, he'd been home for a week or two. And the day he was going to school, he hugged me, which is not common, for him, because he gives me a high five and we were okay. But when he hugged me, I touched his back. His shirt was wet.
He was sweating.
He was sweating. It was 5:30 or 6 in the morning. So first thing I asked him, Iyad, you've been home for 2 weeks. You did not wash your shirt. You waited to wash it a night before going to school. So that's why it's wet. And he broke down. He cried. He cried so much. And his father is telling him, let's go. Because the bus is about to
because the
leave
father
him.
now wants him to be a man, you know.
I knew that is the day I knew there was a problem. But while he was going back to school, there was nothing we could do. I think just to bring you up to speed, we then got called. And the father got called by the school and said, look, this boy has been in the sanatorium one too many times. He's always coming for treatment. We have put him on the drip. We put him on the drip. We have noticed now the blood sugar is escalating. Can we take him to Nakuru, the nearest town? And they said, yes, please take him for checkup. And they went. They came back and said, he seems to have recurrent bacterial infection. That was fine. I told the dad, it cannot be. I mean, I know bacterial infections. So all these stories is to tell you the misdiagnosis. Anyway, he came home. And he came home and we were doing a lot of work in the house. But he couldn't move. And one afternoon, he just went to bed. And when I was looking for him. And I found him sleeping with the hands hanging on the bed.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
So you found him sleeping with his hands hanging. What was your reaction? What came in your mind?
Alan, I was shocked because there is finding someone sleeping and there's finding what I found. And I knew something had gone wrong. So I go pick him up and he couldn't get up. And like I said, his whole bed was wet. His fever, he had extremely high fever. I remember all I did was get him, carry him, put him in the car. All I carried was my handbag because I was going to the hospital. I didn't even tell his brother or his dad.
So you were alone in the house that time?
No, I had people.
But you didn't tell them?
Yeah, my husband was at home. Iyad's brother was at home. All I said is, I'm leaving. And that's how I left.
So you didn't tell them where you're going?
I didn't tell them. I don't think I could comprehend a lot of that time. He wasn't speaking. He looked spaced out completely. In fact, I had to help him get into the car. And we rushed to the hospital. And I even requested them to allow me to go through the normal triage process first. And then I'll come back and register. I remember the hospital saying, but, are you paying cash or check? I said, look, I'll pay anything, Just look at us and look at this patient. They were kind. Then he goes into triage and the gentleman, the nurse, I think about him now, I laugh. He comes back and doesn't talk to me. He calls another nurse and says, sister, machine haifanyi kazi. So the sister goes, they take his blood pressure. And then the sister says, hii machine haifanyi kazi. Let a machine manual, the manual one. So they bring the manual one. And the next thing she comes to me, Mom, is this boy sick?
Of course, that's why we are here.
I said, that's why I'm here. We were not, yes. So is he sick? And from there, they didn't talk to me.
So the blood pressure was very high.
So at the time, the blood pressure was very high. He actually had 200 over 60. And so, of course, I asked them, I said, is there a problem? She said, yeah, the blood pressure is extremely high. The fever had reached 40. And then they told me, Mom, just have a seat. So I just moved aside. And like I said, they didn't talk to me. All of a sudden, a doctor was called and he was put into an admission. And they told me, let's stabilize him first. Before I know it, the doctor comes and speaks to me and says, Mom, we need a specialist. There's a problem. We need to call a physician. And I say, do whatever it is you need to do.
So at that time,
we don't
until
know
this
what
time,
it is.
You don't know what it is?
No.
You've not told anyone?
All they've told me is the high blood pressure. The blood pressure is too high.
So there is a problem.
There's a problem. So they stabilize him. They actually stabilize him. And they tell me we've stabilized him on the pressure, but we have to put him in. I said, before you put him in on any admission, I want this boy checked. Run kidney test, liver test, heart test, run every possible test that can be done. Because my mind was convinced it was not just the blood pressure.
Yes.
So he goes, he was stable, so he goes in to run all these tests. We admitted, of course, day at that time. His results come out. You know, the heart is functioning properly, apart from the palpitations that were extremely high. His heart would beat, he would do 72, 7 to 78. And they had to stop, so he got an injection for that one, for the blood pressure. And then they tell me, this boy has thyroid issues.
So they had done the thyroid test, or
so they did the thyroid test, because when we asked for every test, so they ran every test.
So at that time, is everybody, now people at home, do they know where you are, or still have not told anyone?
So I call home. I call home when the blood pressure was high, because I remembered he's not my child alone.
Yes.
The clan, if anything happens, you know,
they will ask you, why did you leave without telling anyone?
So I call back. I call his dad, and I say, well, we had to get to the hospital, and Iyad is unwell. What is the problem? I say elevated blood pressure. I give him the readings. Thankfully, he's more knowledgeable about medical issues than I am. And he says, what? That is crazy. You know, I'm coming. So anyway, he makes his way. But by then, he was already getting into the lab to have all these tests done. So when the thyroid issue came, I was so confused. Because I have been diagnosed with thyroid, and I'm here wondering, why are we not? Why doesn't it look the same?
Like mine.
Yes, because they told me thyroid.
Thyroid.
Yeah, this, you know.
So they didn't tell you
at the time, whether
it's hypo or hyper. They just said thyroid.
So I'm sitting and thinking, I'm thyroid also. So why is this boy about to die? And really, it was really bad.
Yes.
So I'm wondering, but how can it be thyroid, yet the symptoms are so different? You know, and that was the beginning of the journey. You know, we went through the treatment, and we were asked to see an endocrinologist and a physician. And Iyad just ended up being a very unique patient at his age. He was 16 and a man. We were glad that we also managed to get people who had this disease, who would even begin to explain what it is. You know, then of course get recommendations of doctors. But very unfortunately for Iyad, he developed high blood pressure in there. He developed extreme sugars, diabetes. So he had to inject himself. Of course, he had the heart issue. He had, he lost sight on one side of the eye. He was diagnosed with Graves' disease. So his hyperthyroidism was Graves' disease. And that's why the recurrent infections, because he had extremely low immunity.
So I think what was happening, maybe it was going to a storm. That's why the blood pressure was so elevated.
In fact, when we met the doctor at the time, they said he was actually going into a storm. And a storm is when the vitals of the body begin to fail. You know, one by one, and cannot.
The body is now giving up.
Giving up.
Now, what was the relationship? Now, how was the relationship between Iyad and now his brothers? Were they, you know? I would want to understand, because I know from the experience, when someone is hyper, there is mood swing, there is you get offended very fast. Was Iyad able to?
It was rough in this house. It was rough. So as a person, Iyad is also
he's not
a very soft man.
He's not a pushover.
No, he's not. He has a mind of his own. Hyperthyroidism has extreme anxiety. the temper is this big.
Yes, yes.
Means it's not
yes,
there.
Yes.
You know, he's angry at anything and everything. Everyone is bad. In fact, opening your mouth annoys him. Even just being told, come and eat, is a problem. You know, and the conflict, therefore, in this house was too much. His brothers couldn't talk to him. He yet could not be told anything. And when he was forced, or if you forced it, he would break down and cry. Because he knew he could not angejibu baba yake. The brothers, he would fight back without worry. Sasa baba na mama, he knows he can't, and he's restraining himself. But he knows, you know, I can't talk back. So he would just break down and cry. And he would say, you people don't understand me. And he stopped eating because he couldn't eat, you know, at some point. And the mood swings, whoa, the mood swings were something else. I mean, at some point we said, please just leave him, you know, let him. Which is similarly, you've had his story when he was in school and he had extreme issues with the teachers, and you know, the teacher just said, maybe I don't need this boy in my class.
Nakumbuka akiambia mwalimu, sijui alisema alimwambia bro. Yes, bro. Where bro, you know.
Don't start, you know. And that's why it's very important to watch that show. I hope your viewers can watch that show, mostly because it's important to know that sometimes what our children go through is not what we perceive, you know. Sometimes the extreme anger, the agitation is not just teenagehood. It really is something bigger. So I'd wish for you to see it, to understand it better. I'm glad at some point he had got very understanding. The environment that he had was good. We had an amazing doctor in our case. I stopped thinking I was sick, and I put my head and my focus to him to want to find a solution. We withdrew him from school. He was out of school for about 9-10 months into the end of the year. So he skipped a whole year. But at that time, we felt, you know, health was more important than anything. Health was more important. Because he didn't have focus. He couldn't see. Blood pressure was too much. You know, even the school environment wasn't fitting, because the teachers would tell him, stop sleeping. And you tell the teacher, listen, mwalimu, listen, tuheshimiane, you know. So to avoid all this conflict, we pulled him out of school.
Now, before we go to your story, as we conclude the Iyad story, I would want to understand, or the viewers to know, how was Iyad's reaction when he was told that he's now suffering from a thyroid disease? And I'm sure you also called the teachers and told the teachers, this is what has happened to Iyad, and this is what we are treating, and this is what has been bothering him. How was the reaction from Iyad and both from the teachers?
To be very honest, I think Iyad was very relieved, because he had been told he was on drugs. He had been told he's a rude child. He had been told, wewe sasa umekuwa tu shida. Wewe usikii hata walimu, wewe auambi, you know. So first thing first, and was the case even with us, his parents, we were like, thank God we know what we are dealing with. So Iyad was very happy. I mean, yes, it's a disease, but you finally know. I remember one time when we were I have a very good relationship with him. We are very good friends. And I said, might you have tried something, drugs? And he said, no. And I asked him again another time later, and another time. And the third time he told me, listen, Mama, why don't you just take me for this drug test to get this thing over? You know, because I don't do drugs. You know, so that time I remember when amidst all his illness, all his clouded mind, fatigue, not blood pressure, he was so happy. He just told me, I told you. I told you I don't do drugs. Now you see, kumbe I'm just I'm a thyroid person. You know, and that was good. And of course, even for us, it helped us to map out a treatment plan for him now. We spoke to the school. He had a rough time in school. And it's important for parents, especially when their children begin to exhibit some of these symptoms, have candid conversations with school. Sometimes the schools don't understand these things. And they make it really hard for the student back in school. So much so that they might even begin to hate school. So it's very important. I also want to encourage, if, you know, caregivers in school, doctors, you know, the ones who man the sanatoriums, if a student has come to the clinic 1, 2, 3, 4 times, please put an interest in it. There is no way a child would be coming with elevated blood pressure twice a week, and all you do is, you know, just treat superficial symptoms. Please get into the gist. It could be something dangerous or a little more than what you see. And that's when I went to school and I sat them down and I said, this is him. You know, I thank God he is safe. The story was going to be different because he has collapsed in school before. You know, what if the thyroid storm checked in there?
When he was
a drip
in school,
definitely would not have helped.
Or maybe if he was sleeping in the dormitory, and there's no one to go and find him sleeping there.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
So Rehana, as a caregiver, what was your experience now dealing with a thyroid patient, and as a mother as well too? Now, as a caregiver and a mother to a thyroid patient, what was your experience?
It is hard. I think there's nothing more difficult than already, you know what they say about mothers and their children, and mothers and their boys, or their children generally. So by the time you have been diagnosed with a disease like this, you even forget your existence. I actually did.
You forgot about your problems.
I didn't even think I had problems. And my focus shifted to this boy. When he ate, what he ate, we had bad days. We had very, very bad days. We had days that, remember, I work, you know, I'm a working mother. And there are days you want to leave the house, but I'm looking at that boy and I'm thinking, who will manage him? Who is going to manage him? Because he is not eating. You have to be there. Of course, by that time we were already into medication. Yad would sleep and even forget to wake up to take his medication. But at that time, the heart rate would escalate so high that, you know, it will now bring back the blood pressure. I mean, there was a lot of mixed emotions. Your mind is clouded, yet at the same time, you have to be focused. So I think it's just, for me, was a total shift of the mind. I said, look, my focus is to get this boy well. Whatever it takes. If I lose my job, so be it. I remember even one time at work, I told a colleague, if you can't do it, just forget it.
Just forget it.
I'm not going to be here. When it is the time to take my son to clinic, he will go. Of course, we used to do tests every week for us, because one day he would be good, the second day he would be. So the TSH tests would do them every week. And then the time you do the test, you have to see your endocrinologist, you know, and then of course we had started to see a physician to manage the pressure. So I would have almost 3 doctor appointments in a week. And I would tell them, look, well, if I'm not good enough, find someone else to do it. And I was unable to delegate Yad.
To anyone else.
To anyone else.
So the easiest thing to delegate now was your work.
Everything else.
Everything else.
You know, Yad has a brother younger than him, who's much younger. So he's the baby. I didn't even know he existed, because I delegated him to anyone else who thought, you know, he needed food or whatever it is.
So for me, let me deal with Yad. Anyone else?
Has he eaten? Has he taken his medication? Have we done our TSH? Has he injected? Has he taken his heart medicine? And of course, you know, there's the whole shift of diet.
Now you've mentioned something about shift of diet. I know with a thyroid patient, there's so much more to other things like diet, like what we said, mood swing, you know, the relationship between the patient and other people in the society. So how are you able now to protect Yad from now the external, you know, forces?
Thankfully, the people closest to me, my siblings, and their families, of course, were the most understanding. Yeah, you know, a lot of things change. You know, your social life changes.
Yeah.
Iad's social life definitely changes. Not that he had much, but mine changed, and because of his situation, I'm grateful though that a lot of people around us were very understanding. Generally, I'm a very social person, so I have a lot of people in my house every other time. That had to stop, because when he started picking infections frequently, you know, a small cold and flu would put him down, would elevate the blood pressure. So we changed our life completely. I stopped going out when his siblings, sister, father went out. We would stay home, you know, just to manage him. He was also very conscious about his physical look,
because of the eyes.
Because of the eyes,
and of course the losing weight.
Yes, he was very thin. He has a big structure, so you can clearly tell there's no flesh to the bone. You know, so he was never a small-bodied person. So he had the structure, but he'd lost a lot of weight. He formed a lot of joint problems, pains.
Yes.
So even in the way he walked was to reduce the pain. So he never wanted to be seen. Because of the Graves' disease, the first symptom or the first thing you see is the eyes. So one eye is much bigger than the other. In his case, they were bulged out. He, for a very long time, until very recently, used the eye drops, to create the tear. So most of the time the eyes were red, itchy, you know. And to shield him, you know, a few times when we went to the supermarket, I would see people look at him,
yes,
you know, and wonder. And when he was extremely weak, I would usually hold him. So we would walk and I'm holding him, and I think people would wonder, sasa huyu mtoto mkubwa anashikwa na mama yake. You know, huyu ni wale watoto wa kababa na kamama, you know. But, you know, they don't know what is, because sometimes he needed help to walk around or move around, just assistance. So we stopped this. We stopped this for a while until he gained some strength,
and he came back to now himself.
And however, I always encouraged him to go out. I told him he's dealing with this disease.
Yes.
He cannot hide.
Yes.
Others
so
have it
accept
worse.
Your condition.
Accept it.
Yes.
As long as you have the energy, go out.
Yeah.
Should someone feel they want to ask you, let them ask you, and you'll explain to them.
Yes.
If they just look at you, you know, feeling that you're weird, too bad.
Yes.
This is you. You know, at that time, we didn't have a solution in hand. And I figured if this is going to be our life, then people must just get used to it.
Yes.
Of course, he was getting a lot of sympathy from family, you know. I remember my sister once came when he was at the peak of his illness. And when she went home, she wrote me a message at midnight, at about 2, actually. And she had cried her heart out. And she said she was sorry, because Iad is sick. And I can't believe I'm seeing him in that state. Well, you know, and they were so heartbroken. And therefore what they did is continue. I said, you must just cheer him up. You know, you must just continuously find, you know.
Because now if he's sick and you
tell him, you're sorry.
You're sorry.
Yeah.
You make him feel more bad.
Yes. So yes, we were empathetic, and we gave him room to act all these ways, but at the same time we had to deal with it. But you know, you're very conscious about what he has to eat, what he doesn't need to eat. But I can tell you one thing, and you asked me, how does a caregiver deal with this?
Yes.
It's not easy. It might seem very easy on the exterior, but inwardly,
it's not easy.
It's not easy. You're battling every minute with an unknown symptom or situation. You don't even know, you know, at what point you're losing it or making it. You one time do a blood test, you seem fine. The next day your levels are at 93 or 98. You know, you sit in the house, you've had a good day, at night you have a blood pressure of 99. You know, and you worry every day. You worry. Of course, we had been scheduled. We had decided we'll go through the surgery. And that was another anxiety in its own space. So you wake up one day, his blood pressure is off, you know, because he's scared or he's anxious about it. Caregiving is a full-time job. I think the empathy that comes with it, because he was always hungry. So wherever you go, you must carry food, you know, because you never know when he'll need that food. And depending on where you are, you don't know whether to ask your host for food or wait for lunch. And then there are foods he didn't eat or didn't want to eat. And then there are, of course, the foods that you didn't want him to eat. So your life stops.
So now you start focusing
on just this person.
And especially when you are a mom.
Yes.
Becomes difficult.
Yeah.
Wow. So you went through that and now went to the surgery part. How did you prepare Yad for the surgery as a mom and a caregiver?
In this world that we live in, the technology world, sometimes I think it's even not a good thing, because Yad went on to read about this disease,
the
Dr. Google. He went to Dr. Google. He wanted to find out what thyroid is, of course, to understand it better, because he didn't believe that when we were stopping him from eating his favorite food, bread, he thought it's coming from a bad place. Remember, bread is his life. So now you're telling him not to eat bread, and you're telling him to eat terere, for example. So he, of course, he went and started reading all about it, and he's generally very scared to injections as a person. You know, he's not those usual blood tests as children. He would make a big deal out of it. So now here we are telling him he has two options, which we had narrowed down to. For us, we said we must seek a final treatment. We're not staying to take medication for too long. We had the fear of the liver issues. So Yad, you have to either do the radioactive or surgery. He said, surgery to cut my neck. So he went on reading about it, you know, and he had all the theories in the world. And one day he came and said, look, Mama, we are doing radioactive.
I'm not going to.
I can't. In fact, the joke was, you know me. Even I can't be injected. Those blood tests we used to do in hospital were crazy. You know, he used to tell the doctors, why don't you take my blood for next week and test it next week instead of subjecting me. He told the nurse, mi naheshimu job yako, lakini mi spendi injection. Si uchukue tu blood alafu next week nisikuje. So, so he said he'll do the radioactive. Of course, we eventually made the decision for him. With what we felt was the best for him. And I said, look, the dad said we'll do the surgery, and I agreed to that. That didn't work, because from the day he knew he's having a surgery, he was constantly on hypertensive drugs. Now we even had to increase the dosage because he could not believe they will cut his neck, you know. For him, they're cutting my neck, you know. And the doctor, we went for counseling. And part of what he was told, medical counseling, he was told, you might lose your voice. Okay, number one, it's a surgery. Surgery can go either way. It can go either way. It can work or not work. Issues of excess bleeding and everything. Even a tooth, you can remove it and not make it. So that was one. For that, he was like, okay, you know, we always joke. I always tell my children, when your time has come, it has come. It has come. Roho juu. He used to tell the doctor, I'm okay. I'm okay. If it's my time. It's my time. Nothing. But he could not understand, however, that he'd lose his voice. So that symptom for him was, they cut my throat, Mama. What if they just touch that vocal cord? And that just... He sweated thinking about, even every time we had that conversation, he was sweating. He's a stammerer, naturally. Now his words would never come out with that, you know, in that conversation. And of course, we went for counseling, and we told him all why this and why that. And I remember he said to them, whatever my parents decide, I'll do it. I don't know. I don't want to know. radioactive. I mean, I didn't want the cut,
Yes.
but if my mom has said she wants the surgery, I will do it, you know. And that's how we decided on the surgery.
Wow.
Yeah.
Wow. It's emotional and it's challenging to be a caregiver, like you've heard Rehana said. And I want to encourage that if you're there, you're watching this story, and your son, your daughter is going through moments like these ones, please do not assume things, because they say assumption is the mother of all mistakes. Do not assume. Take your son to the hospital and specifically ask the doctor to check the thyroid profile. Now, I want Rehana to tell this person who is watching us as a caregiver, tell them what they should watch towards their kids. May they be young boys or young boys, young girls or young boys, or adolescents, or even grown-up kids, what they should not ignore, and why it's very important to be close to that kid of yours and make them your friends, so that you're able to pick these small things.
As parents, generally, we often know when children are unwell, you know, even from the time they are born. We can almost, a mother will tell you, I think he's catching a cold. You know, I think this baby is catching a cough. So we sort of know. The dynamics change slightly when they become older. What I would say you need to look out for, it may not necessarily be thyroid, but what you need to really, really look out for is sudden change. You know your child. So sudden change of attitude. I don't think even adolescents, somebody changes one day and they're totally different person. There's always traits and character that they carry. You know, they might be defiant one day, but you know, they're kind and compassionate. So really look out for sudden change in character or attitude. You know, all of a sudden they are extremely aggressive or just docile. They don't talk to nobody. They don't want to interact. They want to keep to themselves. That's a red flag. Extreme change in body size. You know, your child, your son, your daughter has generally been skinny, and in no time the weight is and extreme, and it's not just the eating weight, you know, around maybe the tummy. You can actually tell that this child is growing, the weight is abnormal. That's an area of concern. Recurrent infections. There's nothing normal about recurrent infections. And even if it is normal, there's an underlying problem to it.
What is cause? Why are
there
they,
must be a reason. Yes. So you can't continuously. Doctors tell us, don't get used to malaria drugs. You know, you'll create. What is it called? I forget.
Resistance.
Resistance to the drugs. Likewise, you can't continuously put your child on antibiotics. You know, there's a problem. You know, and then speak to these children. Sometimes they don't want to worry us. And they think if they tell you, you'll start getting too worried. But really speak to them. I remember the reason Iyad didn't tell me a lot of times is the last time he left for school, I was very sick, extremely sick because of thyroid. And he kept saying, don't bother mama. Don't call her. Don't tell her. You know, I'll find my right time to tell her I'm unwell.
Now, when he was in school?
When he was in school. So he would tell the teacher, don't call my mom. Don't call my mom. And later it was because his mom was sick. So he didn't feel like it was the right thing. But sit with them, speak to them. And I remember when I sat with him before he was diagnosed, he told me there is something wrong with me. I don't know what it is, but I can tell you, mommy, there's something wrong with me. I'm not okay.
Well, you've heard for yourself. If you're a teacher, you're a parent, you are a sister, you are a brother, and you have a relative or a friend who are exhibiting this kind of symptoms or this kind of behaviors, it's always good to go and have them checked or advise them to go get checked. We're going to take a short break, and when we are back, we're going to discuss about Rehana with her hyperthyroid disease. Please don't move. Stay tuned. remember to subscribe. Rehana's hypothyroidism, sorry. So remember to subscribe, comment, hit the notification bell, and share to your friend so that we can create the awareness together. So we'll be right back after this.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
To our guest, Rehana, we want to continue from where we left from the previous session. Now we are discussing your story as a patient of hypothyroidism. So you can take us through this from before diagnosis and then after, and the experience that you've had throughout the journey. Karibu.
Asante tena. You know, when I was diagnosed, and I start from a bit of the end, I only knew, you know, thyroidism is hypothyroidism. So when my son was diagnosed with hyperthyroidism, it threw such spanner in the works, and I kept thinking, how many variations does this monster have, you know? So indeed, I was diagnosed first. My diagnosis came almost 2 years after my symptoms had checked in. It could be our own experience, but what we have felt is hyperthyroidism is more fierce than hypo in our situation, not medically. Just to bring you to speed, 2 years before my diagnosis, I started having symptoms. You know, I was losing, adding a lot of weight. I had hair loss. But what bothered me so much was I had tinnitus. So I had this continuous noise in my ears. Yes. I remember going for more than 3 MRIs just to find out and what it could be. You know, initially I thought it's an ear infection or the ear imbalance. Nothing came out of it. Of course, I was put on medication. But it would come. I mean, there were months that I would be fine, you know, and months that it continued on. But I figured, you know, maybe this is something I have to live with. In fact, one person I went to speak about said, mi ukuanga na iyo itabidi uzoe tu, you know, live with it. So I figured.
That was before it was diagnosed?
That was way before.
Way before.
Yes. So these are the symptoms that brought me to diagnosis. So I had tinnitus. Then, like I said, I had extreme weight gain, which now we know better because it is because of low metabolism. Then I generally have very long hair, and all of a sudden it was thinning and falling every day, so much so that I shaved my hair completely. I actually shaved it, because I could not understand what I was going through. Yeah. Incidentally, at that time, my mother was very sick. So everybody I spoke to was telling me, in stress your mom, you know, stress your mom. And indeed, I was stressed. But my stress, I'm a strong person, you know, I generally. So I was thinking, and I'm a believer, so I kept wondering, why is my mom's illness stressing me so much that I can't operate or carry myself? I'm not the type. I was angry at myself. I was continuously depressed. I would lock myself in the room and cry. I would isolate, yet I'm a social bird, you know. I would want to be alone. I hated people. I was just constantly angry. And, you know, I hated my marriage. I hated the man I was married to. I started looking at my children thinking, you know, what's happening?
You don't understand.
I don't understand, you know, and it was so bad that I went to this doctor and I said, I have a problem. Well, I was recommended to a doctor. And the doctor said, you're depressed. The diagnosis came out as depression. I was actually put on antidepressants. I took the antidepressants. And I would feel happy, like any other person who's on antidepressants.
Okay, let me take you back. Is there another test that they did to you? Or they only, from the explanation that you gave to the doctor, they only picked out the depression part? but not the other symptoms. Did you try to explain to them, this is how I'm feeling, and this has changed since this and this time, or you yourself, you thought you're depressed because your mother was sick?
Remember, I had been seeing doctors. You know, I had so many symptoms, and I had done many tests. I had done blood tests. I'd actually done a kidney test. Incidentally, I don't know why the first thing that comes to mind for me is always a kidney test. So I had done a kidney test. I had already done a couple of MRIs because I thought I had a problem with either the brain or the ear or stability. I had been to every hospital possible to ask what could be wrong with me, you know. And therefore, like any sane person, when you're told, I think you need to see someone specialized, it could be a mental issue. You don't ignore it, because you can't ignore it. You have gone through everything else that you needed to check. So when I went and I was speaking to the doctor, and I was saying how, you know, I cry at anything or nothing. I am unhappy.
You're right.
I'm not liking the space I'm in. I'm just an unhappy human being, and I want a shift of my life. And of course the circumstances behind it. And yes, then I was told, oh, this is depression. And I was put on antidepressants, which I took for some time. And because maybe I was not depressed, one day I woke up and I said to myself, you cannot be depressed, Rehana. I mean, how? Yeah. No, in my mind, though, I didn't have that one thing to make me depressed.
Yes.
So according to me, and now that I look back, I was actually not depressed as clinical depression.
Yes.
So I woke up and I said, but what is this that is making you depressed? Okay, it's your mother, she's sick. At the back of my mind, I'm thinking, who told you were privileged that your mother was not supposed to be sick?
Yeah.
And you know, what problem is this? And there was none. So I took my medicines and I flushed them in the toilet. Because I said, I am not depressed. And if I keep them, I might keep taking them, because you're happy when you take depression medication. You're feeling good. Everyone around you is happy, and everyone encourages you to take it, because now all of a sudden, even the husband is happy because you're always smiling, you know. So I figured if I keep them, I'll take them. So I threw them. And I didn't take medication for a while. But of course, my symptoms kept coming back. So I stopped eating. I went on all possible diets that you can think of. Keto, don't eat, intermittent fasting. If I met you today and you told me don't eat meat, I'll stop eating meat. Tomorrow, if they tell me leave dairy, I'm out. You know, and I almost started eating ice because everything, there's nothing else. But the weight was just there.
Still coming.
Still coming. I started running, exercising. I even went to the gym. I remember I paid 6 months. And I didn't go for 6 months, but I paid. I think I was tired. And one day I went to the doctors and I said, look, Dr. there is a problem with me. I actually need you to find whatever it is, and I am not living here until you tell me what the problem is, because I am not ignorant. And there is no way that I am telling you how I feel. I started having very brittle nails, very, very brittle. I couldn't even grow it. They would break. The hair was a story. I told you, I chopped my hair completely. I was like Jada, you know. So I went and I said, Dr. there's a problem. So much as I don't know what the problem is, but I know there is a problem.
Like after how long?
That was almost 2 years after my initial symptom.
After now depression?
After depression was about 5 months. Yes. That was 2 years after my tinnitus issue, you know, all those. And then, of course, depression. And then I stopped taking medication for 6 months, 5 thereabout. But I still knew I wasn't fine. At least I knew this is not what a body would be, you know. Anxiety, continuously angry, totally unhappy. I was cold every moment. I was always feeling cold. I was always in a sweater, yet I don't have a fever. I mean, when the weather changed, then it would be in July.
And you're still feeling cold.
And I'm cold, and I'm dressed up so well, and I'm extremely cold. So I said, there is a problem. Of course, we did all those initial tests of UTIs and blood pressure, and luckily I didn't have blood pressure. So we did the test. When I said, please let us have everything possible checked. We did it, and the results came out thyroid. That was actually the first time in my life. Well, I knew the thyroid gland.
Yeah.
I'd heard about it. I didn't even know there was a disease that would be related to a thyroid.
Yeah.
So when I was told thyroid disease, the first thing I did was,
what came to your mind?
I don't know, I'm dying. You know, maybe I'm dying.
Yeah.
What is thyroid? You know, the first person I called was my brother. He's usually my to-go person. When I say, wewe umewahi kusikia mtu ako na thyroid? It's like, thyroid, yeah, the thyroid, yeah, thyroid disease. And now the doctors are telling me I'm on extremely low levels. It's like, hey, hiyo ni nini? Well, you know, we all know thyroid even in the way we know it.
At this point, the doctor told you you have a thyroid issue. The doctor explained to you, seeing a general doctor.
At the time, I was seeing a general doctor.
The doctor explained to you what this thyroid is and what you're suffering from and how you can, the first thing is thyroid.
So he told me thyroid from the results. Of course, I can read it and I see. I know what thyroid is. But how do you even get to a thyroid disease? I don't know. And he told me, he said, now you must see a specialist.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Yeah, so after all the diagnoses, so I decided, you know, Doctor, please let us just narrow down, run every possible test. We need to know because we can't be dealing with what we don't know. All I'm saying is I'm not fine.
Yes.
He says, so what do you think you have? I said, I don't know. In fact, being the Google person, I've tried, but I couldn't figure it out. So this general doctor ran the test and I was told it's thyroid. I didn't understand thyroid. But of course, you go back to Google and you read widely and, you know, you get to understand it. And I began to understand it. He referred me to a physician and said, Sasa, lazima uone a specialist who take you through the journey. It's manageable. Of course, he told me it's manageable. I did see a physician. We started on the treatment. I didn't feel good immediately.
At that point, when you were told you have thyroid, what was the feeling? It was, at long last, I know.
Yeah, you know, like every other disease, when you have something that is uncertain, you're battling with so many things in your heart. You know, at some point you're even thinking, I could actually be depressed.
Yeah.
Or is this a failure of an organ in the body? And if it is, am I dealing with a kidney organ failure? Is it liver? Is it my heart that has a problem? You know, what is it?
Yeah.
Or is something eating me from the inside? Of course, I used to know autoimmune diseases. So I'm wondering, maybe something is eating me from the inside. So it was a relief, you know, much as you're being told you're sick, but you're finally thinking, at least they have narrowed down to what it is. In fact, I asked the doctor, are you sure? Like, yes, like, I'm happy it is. You've told me it's thyroid, but are you sure we are not going to tomorrow to find out it's something else? I said, thyroid, you know. So when I went to see the endocrinologist, and she explained it in so much details thereafter, so I understood it. And then we began the treatment journey. And it's not miraculous, so you don't wake up one morning and you're fine. Some days you're good, some days you're not. The days you cannot get out of bed. I remember there were days I had severe from my hip on the left to the knee. I couldn't move. And therefore, by extension, because I couldn't walk much, my left mguu, chini, was always swollen. So I was told I have a problem with circulation. So there were days I could wake up and the left leg could just not stand or move. And the knee had major pain. The leg was always swollen, but you know, you live with the symptoms every single day. The depression, the anxiety doesn't go, you know. So they start you off in a certain dosage of the medication, and you keep changing it as your day goes. I would do my tests every month, and depending on the levels I was at, we would change it whenever the doctor felt the need to.
Okay. So at that period before diagnosis and then after, I know you're working. How was your experience going to work? And here you're battling a disease that you don't know. Your relationship in your family and also at work. What are some of the challenges you experienced, and how did you maneuver around? Because I know being a career lady, a mother, a wife, there's so many things to juggle around there. You have kids, you have an husband, you have a work to keep. Yeah.
Challenging.
Yes.
It was so challenging. First of all, at home, everyone is walking on eggshells around you because they don't know if the next thing they will say you will erupt. Yeah. Maybe you'll cry. You know, in fact, when I look back now, I feel really bad because my children must have thought I'm going through something worse than it was. Because which grown-up adult just locks themselves in the room and doesn't want to talk to people? But even before I go back to the home setup, I give you a story. I worked with Alan. Alan had hyperthyroidism. In fact, he was the first person who had ever told me about thyroid, and I totally ignored it. I remember where we were, and I said, I'll listen to this at home. And when I went home, it was through Google, because I didn't even understand what this was. So after my diagnosis, I come back and tell him, bro, thyroid. Ama ni kwa vile tumejuana. How? So we would laugh about it. Now, the simple thing is, Alan, when I never used to eat. Yeah. My colleague, Alan, had hyperthyroidism. So they had very high metabolism. Yes. This guy would carry food. For breakfast, he would have nduma, ongwashe, boiled maize, ikipita, na alikuanga na thermos yake, anabeba chai, you know. And I used to ask him, what's wrong with you? See, we're having tea in the office. No, you know, I don't take dairy. This is, you know, so lactose. Lactose free. Lunch, he looks at me. Tunaweza enda lunch. Meanwhile, for me, my metabolism is so low, so I'm never hungry. So you're full. Asubuhi, I can sustain. In fact, paka jioni, it would sustain me. Now, I would look at this guy and wonder, what's wrong with you? How does this guy eat? But that was not the worst. Hyperthyroid patients are always feeling hot. Yes. So he had a fan. I was a hypothyroid patient. I was constantly cold. So I actually went and I bought myself a heater. And I put it under my desk. So you have... Please remember, I am sharing an office with this gentleman. Hypo. Our office was just this big. 2 windows. So you either close it, see at upande ile, he has his window and I have it here. So the windows are either open or closed. That war was World War II. Because he would put the fan on and my heater is, when he sees my heater on, he puts it, when I switch, Sasa, it was a conflict. He tells me, Rehana, it's too hot in here. I'm telling him, Alan, my friend, I am so cold, my feet are frozen. And we went through that. Of course, by then already we knew what we had. So we only understood each other. But what we had in common, though, was one, memory lapse. Yes. Now, he was reporting to me. And every time I told him something, not every time, but most of the time, he would forget. Yeah. So the joke was, when I speak to you, please have a notebook. Just diarize this, you know. And now, maybe he was lucky. He had me, who was a bit understanding. Now, I didn't have people who were understanding around me. I don't have a very gentle boss in terms of temper. So every time he would get angry, I would be 2 times angry. because my anxiety is wild. You know, there are times I would be tempted to tell him, you know, I really don't need this job. Until I'm calm, I realize, oh, you know, you really need this job.
Yeah.
So there was all that conflict. And you know, in a workplace, not everybody understands you. Or if they want to try to understand you, they're thinking, enda ukue mgonjwa nyumbani, then you'd come back, you know. So there was a lot of conflict. So my workspace was not good. I mean, there was no such understanding. Home setup was much different. Other than the fact that I said people were walking on eggshells, but there was a lot of understanding. There was always wanting to see that mommy is okay, she's fine, you know, there's nothing necessarily stressing her. So much so that they would even stop to tell me their own issues, because we would normally talk about school and friends, and so they would keep it off. So it was challenging. There are days I didn't feel like talking to a human being. Now, unfortunately, I didn't have a place to go. So you just find a room in your own house or your own room and lock yourself. A few times I would even lock myself in the bathroom so that nobody talks to me. When hormones fluctuate, it's a totally different ball game. You know, my friends would call and say we were going for lunch and I wouldn't go. I actually recall I have a set of friends that we've been together for over 20 years. And they would not understand why are you not coming all of a sudden? Because I didn't want to tell people I was sick, but I was always unavailable. Yeah. Every time, and they reached out and I explained and I said, you know, sometimes I don't even want to socialize and come and laugh with you. I don't feel in that space, you know. Yeah. So for those who would understand you, it was easy. There are those who thought, kwani alifikiria peke yake ndio mgonjwa. Exactly. But you know, there are also those who now decide. In fact, we are not calling her anymore. Wacha siku ile akipona atatuambia. There were those also, but it's what it was. Yeah.
Interesting. Then after now you've started taking the medication. How long did it take to start seeing the changes, and the diet-wise? What changed in your life in terms of diet? And then now the recovery process, whereby you're taking medication, the journey. Walk us through the journey now after now started taking the medicine, and what are some of the food that you needed to stop, and what you need to eat and exercise, the lifestyle change.
It's not easy. I think changing lifestyle was the hardest thing for me to date. Yeah. Because I took my medication religiously. I exercised where necessary because I was told it's the best that would help you sleep better at night. Up to now, I still have challenges in food, on what to eat or not what to. Of course, I have food discipline, so I try to cut out to say, you know, stop taking dairy, milk, for example, cut out on red meat, eat a lot of roughage, you know, green vegetables, cabbage, for example, fermented milk and porridges. I tried it. I didn't sustain it. I hope that I can continue to sustain. However, I'm religious in taking my medication. So I am now even at a reduced dosage of the medication that I take. I think, and considering that it's a lifelong medication, I have to live with this. I will take it for the rest of my life. What helps me now is, I told you, I was speaking to Alan and I said the story about my son who after surgery now moved from hyperthyroidism to hypo. So we are together. So we stopped. Initially, we used to have a joke. You know, initially, after the conflict, the joke was, why don't you bring your low levels and this one bring his high, and we sort of get to a middle ground, so that we can coexist. Now we remind each other. We take your medication. He takes more than me now, but we help each other because we know where we are from. So we actually used to have a tab for drugs, so we have it. Of course, now we take much more. We have to take memory drugs. We take selenium, we take the multivitamins. We are living with them, with the omega and the rest. immunity still remains very low. Fatigue, echo, there you have good days and you have bad days. But you just have to keep up, look up. I keep saying that the fact that you know what you're suffering from and you know what you need to do or not do, you've got to manage it, But it's so important to get checked so that you actually know what you're dealing with. Because before this, I was just freelancing, I'm sick, but I'm not on any medication. Yeah.
Okay. At this point, when I look at you, I see a very strong lady, because being a caregiver and being a patient, and at the same time, they are conflicting. And now, I just want you to tell us what kept you moving. Because you're the caregiver, you yourself, you're sick.
Yeah.
From experience, I've been a caregiver, and I know how emotionally it drains you. And now, in your case, you're sick, and at the same time, you're taking care of hyperthyroidism, which is totally as extreme symptoms, opposite to
what you have. Yeah.
I don't know what was what kept you moving, because I know it's tough.
It is tough. I mean, when you talk about it, and especially speaking from a point of experience, you would understand. It drains you. You lose yourself in the process.
Yeah.
If you start just thinking of the other person. But remember, we are also human beings. You have to be you.
Yeah.
So sometimes you actually get tired. You're tired. You can't. You almost feel like you're living two lives.
Yeah.
But personally, I generally always feel like I'm not strong. Not to say I'm strong, because nobody, at some point, everybody has a breaking point. But I figured we have this disease.
Yeah.
We have to deal with it.
Yes.
We have to live. We are not dead yet, at least, because at some point we will be. But until that time, we have to live. And it can't be miserable. So, man up, I used to tell my son.
You have to accept first.
Yes.
Yeah.
And the acceptance also has to be in the mind.
Yeah.
And you've got to just know this is it, Yeah. So I used to tell my son, man up. I'm also sick. I don't want people to be sorry around me.
Yeah.
And likewise, you don't want people to be sorry, for you. So you're sick, we are sick, we're moving. In our case, we had other people around us. Yeah. My husband, I have other children. Now, if we live wallowing in, oh my God, and us, we are the sick ones, really, it's even depressing to other people. So what motivated me is just life. Yeah. There was so much more to look forward to. There was already a blessing in that we were told what we were dealing with.
Yeah.
And therefore, why not just follow? And at the end of the day, and not wanting to sound cliche, but we really also anchored in God.
Yeah.
And that was the complete driving force.
Yes.
Like, you know what? He could not have brought us here.
Yeah.
If we were not meant to take care of this. Yes. So after everything else, just the belief in God that one, he knew we were to get this. It didn't surprise him. It only surprised us.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.
Okay, Rehana, you've shared with us what kept you moving, what kept you going during that period. Now, I want you to tell our viewers what are some of the symptoms they need to check out for both hyper and hypo, now that you're both a caregiver and a patient for hypo, and even our work environments. You can tell out most of the employers and colleagues, because you, from experience, this thyroid disease, it's less known outside there. People have little knowledge about it, and you might be sitting in an office whereby you can see maybe someone who reports to you, or or someone you report to is having all these symptoms and you can't really understand this person. It's a message that should go out there to organization, employers and employees to try and accommodate these people, because they need someone, they need a listening ear for them to carry through the sickness. Yeah.
That's right. I think the biggest burden falls on an individual at the beginning. You know, we've talked about all the symptoms. There's now a lot of knowledge going around. Of course, not everybody knows about it, but we know the basics of the symptoms. Yes. And we've said even in the past, know your body. And when you start to notice certain changes within yourself or the people around you, be your children or your spouses or your parents or, you know, the people around you, sudden changes in the body, you know, all of a sudden you've added weight or lost weight, your moods have shifted, appetite is fluctuating, recurrence of infections, for example. So the burden stops with you. Before the people around you perceive or care for you, go get tested, go get checked. And you recall in the past, everybody who, back in the day, if you coughed, traveled, and you know you had a mild fever, you go to the doctor and say, "Nipime malaria."
Yes, yes.
And now we need people to go out. The moment you have these symptoms that are slightly unknown, tell the doctor, "Can we check for thyroid?
Yes.
Or check my levels of thyroid?" Sorry, you know. So we need to, and I'm so glad about this show because it helps people to know what it is.
Yeah.
So once that happens, I think it's also very important to educate people, because this show is not just about sick people or understanding that you're sick, but the people around you to be able to know how to deal with you and care for you and to live with you generally. So the schools, for example, teachers, you know, the nurses back in schools must be able to see this patient is already sick. This is what we expect, and this is how we need to manage them or handle them or be around them, as is the case in workplaces. So it's not always that, you know, people want to be lazy, not do their jobs, or want naps or breaks in between their 8 to 5 jobs. Sometimes it is beyond what they can control, and therefore there's got to be this knowledge around this disease. Schools, for example, there's so much leeway to patients who are diabetic, for example. They're allowed, no, it's time to go get your jab. You know, today your blood pressure is high, so you're excused from. Expectant mothers are told you need a break. So there's got to be this knowledge. And employers must be able to understand that it is a disease like all the rest, perhaps even worse, because it borders mental. You know, now there's all these issues around mental concerns. And if this is not checked, you can actually think you're losing it. We've had cases where you find someone has been taken to a mental facility, and reason being thyroid that has escalated to a point that everybody around you thinks that you're mad. You're mad. But someone would think, because you're isolating, you're when someone talks, you're angry. And therefore there is need to, and even as you guys run the show, and we are very happy that you do, it's not just for the patient, it's also for the people around them to know that silent as it is severe, and there is really need to manage these patients and care for them in that space, to understand them a little better and a little more, as the case with the rest of the diseases. I'm thinking right now it's a space whereby we need to shout so much about thyroid, so that it can be a norm. When you go to an hospital, the first thing the way they normally check your blood count and everything to check what's wrong with you, they also prioritize thyroid.
thyroid function test, because thyroid, if your thyroid is not okay, then your body system is not working.
Absolutely. I sit in, I'm a member of a foundation for thyroid, and 90% of the patients or caregivers within that group tell you at the beginning it was a pure misdiagnosis.
Yes.
Even from medical practitioners.
Yes.
It was almost a guesswork. So I agree with you. Other than the usual, check their blood pressure, check their vitals, check the thyroid levels.
Yeah.
It's got to be part of it, especially when the symptoms align to the disease. Yeah.
Okay. Thank you, Rehana, for taking your time and being vulnerable and telling out your story outside there to our viewers. Thank you also for taking time, even sharing your son's story and your story as a caregiver. And then to our viewers outside there, thank you very much for tuning into Health Talk Desk. Kindly don't forget to like, share, subscribe, and also even share this story to your friends so that we can create the awareness for thyroid. And you'll be getting more of this episode, which are educative, and we'd like you to share with your friends. Tell a friend, so that at least we can create the awareness for thyroid. Have a friend outside there, even a colleague, a family member, and together we can win this battle called thyroid. Thank you for watching, and until next time, bye-bye.
Join us at Health Talk Desk. Make sure to subscribe, like and share our videos to keep spreading vital thyroid health insights.